Hi, my name is Ross Leach, and I will be arguing for and against the fact that vaccines should be mandatory for everybody. Some common 4 points to start would be that vaccines allow for the general safety of the individual. And kind of here's just some facts that I'm going to spit off from dosomething.org. First, vaccines prevent more than 2.5 million deaths each year. Most diseases prevented by vaccines are no longer common in the US, and quote unquote, if vaccines weren't used, just a few cases could quickly turn into tens or hundreds or thousands. Just to put it as simply as possible, those facts just show that vaccines do allow for safety. But against that, what can commonly be said is that vaccines can actually make the individual more sick and in some cases even kill them. Um, and that it is said that by putting the actual illness into somebody's body, it is possible that the vaccine could do the exact opposite of what it's meant to do. And for example, what we've seen in America at least is that one of the most common vaccines, which is the flu shot, which is mandatory for almost everybody in the medical field, has been known to cause short-term illness in those who receive that vaccine, and in some extreme cases even cause them to die because they had some sort of weak immunodeficiency. Um, my second 4 point would be that um, the vaccines allow for the overarching safety of the public. Now, this is the most important point because beyond the safety of the individual, it's essential to allow safety for other people since if you don't have a vaccine or somebody who doesn't have a vaccine and potentially has a virus can more easily spread it to somebody who has never gotten a vaccine since they don't have any line of protection. And this exact thing happened. In 2019, a measles outbreak occurred in New York State that inflicted about 200 people and ended in several deaths. But more so, the biggest thing that happened is that outside of that particular area of New York, people got infected. Specifically, it spread to Texas. And that happened because people traveled to Texas. They couldn't pinpoint it to one person, but they know that there were people who did travel to Texas in one area, and it infected around 50 more people in Texas. Um, Also, on top of that, just to kind of put in perspective the safety of the public. Over the past 60 years, there's have been vaccines that have been known to eradicate diseases. For example, those would be smallpox and polio. And as we know, polio was one of the biggest diseases and one of the biggest had one of the biggest death tolls in American history. Um, and against that, one large point that the opposition would use would be religious oppositions. And it would be said that forcibly making people get a vaccine directly contradicts the First Amendment of the United States Constitution. That is absolutely true. If it is against one's religious beliefs to oppose something, there should be absolutely no one to tell them that they can or cannot do otherwise. It's just that's the First Amendment, free speech, freedom to choose one's religion, all of those things accompany that. And but also, many of those people who do hold these religious beliefs say that it would be more so immoral than just going along the Constitution. They bring into it morals. Um, but for argument's sake, moving on to the third 4 point of the argument would be that if made mandatory, it is most likely that the vaccine, whatever it may be, would be covered by copay. And what that means is that it's not essentially free, but for those people who have insurance, their copay is covered, meaning that they have nothing to pay as long as you already have insurance. And once again, we can thank the the Affordable Care Act to that, which is what Obama put in place, Medicare, Medicaid, those types of things. And it's basically put in place that all essential vaccines are covered by insurance. And those essential vaccines include things like the flu shot, hepatitis B, measles, really those things that have been common and can occur again, most likely, they are covered by of the Affordable Care Act, even though it is no longer in place today. And then exactly that is a con point for the opposition, because quite simply, the Affordable Care Act no longer exists. Over this past presidency, that bill was eradicated, and since it does not exist, uh, there is no longer a guarantee that those vaccines can be covered by an affordable health care system. So since that since that they're no longer covered, they're almost put into the hands of larger, more expensive insurance companies, not Medicare or Medicaid, which they were covered for previously. So, the opposition would say that it's not a likely thing or a realistic thing to be able to obtain these vaccines since they are not affordable anymore. And to close, I would like to state that I think that vaccines should be mandatory for everyone because they allow for, once again, the safety of the individual, but more importantly, the overarching safety of the general public. And they also could be, I think that the benefits are much larger than the negatives in this situation. And to apply this to today, I've learned that in my research that this argument is applicable to society today more than ever. And what we see right now with the current global pandemic, coronavirus, COVID-19, that essentially, well, hypothetically, if a vaccine were to come out as soon as there would be if a vaccine were to come out, there would be plenty of people who oppose it, and that's likely for all cases, and they would choose not to receive it. And essentially, what would happen is this lack of universal vaccination could allow for the virus to go away, be eradicated, but it would become seasonal because there would be certain people who would be susceptible to it in this exact spring season, and then it could be coming back year after year, which is not something we want. Thank you, guys.